Today, I'll give you a quick, clear overview of intensive therapy, what it is, where it comes from, and the models used, and how it benefits those seeking deep, focused healing. My name is Virgil Sherry Reed, and I am a clinical trauma focused psychotherapist, a licensed mental health counselor, expressive arts therapist, a clinical supervisor, peer consultant. I identify as an integrative, depth oriented, trauma focused psychotherapist with over 12 years of clinical mental health counseling and psychotherapy experience. In addition to that, I co facilitate a brain spotting therapy peer group in the state of Massachusetts. I'm an adjunct instructor professor. I specialize in working with complex trauma, dissociation, identity based struggles. I work with individuals, couples, expansive relationships, and supportive work with military service members, veterans, and their families. I have a special focus on persons of color or people of the global majority, LGBTQIA community, those who identify as indigeneity or indigenous, native, and first generation population. So, intensive therapy is essentially condensing weeks or months of therapeutic work into a shorter, more concentrated time frame. Sessions typically run anywhere from 3 to 6 hours in a day. This model is particularly very effective and powerful for deep trauma processing, relationship stabilization or repair, or situations where traditional weekly sessions feel either too slow or disruptive to your current lifestyle. The goal is to accelerate progress in a condensed time period. And often, a lot of people seek out intensive work because it's short term and it's focused. So I'll share with you 4 points about intensive therapy. And I want to take the roots back to what was considered the first intensive or crisis treatment, which spanned between the 1960s, respectively, to the early 1990s. And this was focused primarily on intensive short term dynamic psychotherapy work. And it demonstrated how effective condensed or concentrated hours of therapy supported their clients. Since then, therapists have adapted the approach across multiple modalities, multicultural frameworks, and client needs. It went from intensive short term dynamic psychotherapy to then emotionally focused therapy, onward to EMDR, and now brain spotting, respectfully. This work, intensive therapy, can be used worldwide with individuals, couples, expansive or multiple partnerships, family work, and even children. So I'll share with you common intensive therapy models. First one is EMDR. It stands for eye movement desensitization and reprocessing. This is depth oriented psychotherapy work. We have emotionally focused therapy, which is attachment repair for couples, relationships, and individuals. We have brain spotting, which is accessing and processing deep brain and body based trauma from the neural pathways. We have additionally somatic, expressive arts, and other respectfully integrative trauma models that show the same exact brain body approach to intensive therapy work or trauma work in general. Now, when we look at all of these modalities, many therapists also integrate somatic work, energy work, arts based work, mindfulness for a whole person approach. I find this to be highly effective to meet the needs of an individual. Similarly to myself, I understand the value and effectiveness of a personalized and a whole person approach. Who is this model for? Who is intensive therapy model for? It's for people in life transitions or in crisis. It's for people who have experienced trauma or working on deconstructing and healing from chronic based or exposure to chronic based trauma. These are for people in high stress professionals needing targeted breakthroughs. This is for relationships needing focused relationship repair and stabilization. This format can be ideal for those who've survived or are thriving from traumatic or highly distressing experiences, people navigating life challenges or transitions, couples in distress or needing stabilization or relationship repair, and for people who have high stress professionals who can't commit to ongoing weekly therapy but need deep, targeted work and in a short term focused approach. I'll share with you 5 points of the benefits of intensive therapy, and there are a lot more other points to make. The first one is this is a faster progression for those who are looking to either they feel maybe stuck or they're finding themselves to have a roadblock in their traditional therapy format. Often substitute this as part of what's called a parallel or adjunctive therapy model. So that is another alternative for those who are in traditional weekly or biweekly therapy. It does show from data that there's a faster progression in the work or in your therapeutic goal. This provides deep focus without weekly interruptions for those who have a lifestyle that requires them to do short term work. There's greater emotional safety in one container working with this therapist. It can access and address layers upon layers of trauma. This is flexible for travel or for busy schedules. I find that one of the biggest benefits is the momentum. You're not waiting 7 days to pick up where you left off. You can go deeper in one sitting with the safety of a contained process and a space to work through multiple layers in one go. So, what is your investment? And this answer will vary because the cost varies by therapist and by location and by experience. From data, often ranges between $500 to $2,000 per day, or what's called per intensive session. For many therapists like myself, this investment may include follow up sessions or additional resources. It is very important to understand that intensive therapy is likely not covered by any health insurances based in the United States of America. Intensive therapy is a bigger upfront investment. And when you factor in the amount of progress, stabilization, and repair made in less time, it can be very cost effective compared to use of health insurance or compared to months of weekly sessions. Some therapists offer payment plans or sliding scale rates. When choosing the right therapist, I want to just point out 3 things, but there are many more other factors involved. The first is when you are in that initial consultation, you want to talk about the credentials, the trainings related to intensive therapy, the sort of approaches used in therapy. You want to talk about the therapist's experience, any concerns you may have going into an intensive therapy framework. You want to clarify what is the format? Is it in person, virtual, or hybrid? What is the cost and the formality of making payment? And what is the aftercare support if there is additional support post integration? Not every therapist is trained in one or more intensive model work. Ask about their specific trainings, their experiences, their interests, their specialties, what type of concerns you may have. Ask what does aftercare process might look like for you or part of the intensive therapy approach. It's good. I consider good aftercare helps with integrating the gains and insights from an intensive therapy session about 6 to 24 hours afterwards. So, how does one prepare for an intensive? This is going to be very different between, various between therapists and between locations. But here are some things that I do share with my in person or virtual clients. Number one, I need you to find a private and undisturbed location or arrive on time at least 10 minutes prior to the location for your in person session. Number two, bring your snack preference of choice if one is not provided to you in person office, a warm or cold beverage. Have a weighted blanket or a comfort item with you. Prepared to have noise canceling headphones. And this is essentially important for those therapists who are using sound based music as part of one or multiple approaches in their intensive model. Please ensure if you are a virtual client or a telehealth client that you have reliable internet connection and devices readily available and they have been updated to the highs of their software. Eat a balanced meal about 1 hour before. Drink enough water to your liking. Arrange for emotional support for after your intensive session. For all in person clients, have a wellness care plan or have discussed one with a close relative, a loved one, a friend, or your therapist prior to your intensive therapy day. Preparing well for your intensive helps set you up for success, whether in person or virtual. Make sure you are in a private, uninterrupted location. Have water, your favorite snack or beverage nearby, along with tissue and light snacks. Comfort items are always welcomed. Please have noise canceling headphones can help reduce and feel more grounded in virtual meetings or even in person if music or sound based approaches are utilized. I always recommend eating a well balanced meal about half an hour to an hour before so your body feels nourished but not heavy. For in person work, it's important to arrange for a wellness care plan ahead of time, like someone who can check on you after your intensive session. It is very helpful. I always recommend to review for yourself any articles, handouts, or videos your therapist may have provided or that you have researched to feel more informed before starting. And after the session, allow yourself some integration time. This means maybe sitting in your car or waiting for your Uber ride and journaling, listening to some calm music, making a quiet or calm phone call, doing a mindful activity. I always encourage, most importantly, avoid any high stress situations immediately after so you can gently process what we've covered in that session. Here are my final thoughts here. Intensive therapy is just one pathway. Healing can happen faster than you think. Remember, healing is not about rushing. It's about giving yourself the right kind of space to process and grow. If you're curious about whether intensive therapy might help you or someone you know, and you are interested in more information about me, you can visit my website for more resources or schedule a free intensive therapy consultation. You can also find more resources on my website and on my blog, where I provide a ton of tips and resources for individuals, couples, expansive partnerships. Thank you so much and be well.